Hi. So in the last video, I spoke about fasting insulin and how it is important to help us prevent the risk of developing diabetes, right? So today let's talk about what exactly this fasting insulin is and how it helps us. Okay? So insulin basically is a hormone that is produced by our pancreas. Now, the main job of this insulin is to make sure that the glucose uptake is happening properly in the body. Let me simplify it for you. So basically, whenever we eat some food, what is getting produced eventually is glucose. No matter what you eat, eventually it will be broken down to glucose, and then that is how the body gets energy, right? So every time there's glucose formed in the blood, the insulin is going to take that glucose along with it and go and knock at the body cells. Okay, so now this cell, in response to this, usually we will open the door and allow the glucose to come in, and this keeps happening, and the body will keep functioning normally with that glucose is coming in and it's getting its energy. So this continues until what happens is there's too much insulin in the body, and then that gate doesn't open. So this is how when someone is repeatedly telling us something, constantly bothering us, what's our reaction? We start ignoring that person, and you're like, no, I'm not going to listen to this person, right? So that's the same thing that happens with insulin, because it's repeatedly going to that the door. They stop entertaining insulin, and as a result of that, glucose is not entering the body, right? So this is what is insulin resistance. The body is not listening to that insulin anymore, and eventually when this happens, what will happen is the blood glucose will start rising in the blood. That's how you get diabetes. Okay, but till this happens, the body will constantly be trying, to get that glucose inside. Yeah, so again, in this situation, what happens? Normally, if one person says something, we don't listen. Maybe if we try with two people or a group, we may get a better response, right? So, even in this case, normally, say if one molecule of insulin was needed to transport that one molecule of glucose, slowly it will start needing more. So it will need two, then three, then four, and so on. It will go on increasing. Okay, so this will work well, like your blood glucose levels will be normal, but it would be happening at the cost of that insulin being produced more, as a result of which your pancreas are overworking. Okay, now eventually what will happen is, even after producing 25 or 30 units of insulin, even when that 25-30 units are taking one molecule of glucose, that gatekeeper is still not interested in opening the door. Okay, so what happens, even if I have to relate this again to a human situation, you will try saying once, twice, you will go with a group, all of y'all will make a big ruckus about it. Still, if someone's not listening, what will you do? You will be like, forget it, that's how it is, it's not going to happen. So when your pancreas also reaches this situation, it will say forget it, and it will stop producing insulin altogether. Yeah, so we hear this with diabetics, isn't it? Someone who's had diabetes for 20 years, 30 years, eventually they start taking insulin injections, correct? So that means that pancreas has reached that point where it's not producing any insulin. So now what is the role of this fasting insulin test? Yeah, because normally what happens is we are told to check our fasting blood sugar and HbA1c levels. Till that is normal, till that is not in the pre-diabetic or diabetic range, we are told we don't need to worry about anything. So now that you know this whole background story, you understand that your blood sugar levels can be controlled properly, but it may be happening at the cost of your insulin being higher, or at the cost of your pancreas being overworked. Okay, so this, the higher end of normal range, which you normally see on your blood report levels, right? Blood reports is normally 25 to 30. But beyond this 25 to 30, what happens is you're going to be a diabetic. So can we consider that as normal? We cannot, because then where do we have the time to prevent anything, right? So the golden number here is 5. We need a fasting insulin to be under 5, so that we can be sure that there's no risk of developing diabetes. And of course, we need to maintain it that way so that there's no risk in the future. Okay, so I hope you have got a basic idea of what this fasting insulin is. And definitely, if you have any questions, please feel free to reach out to me. Bye.